Thank you for watching this video. We at Ebenezer Healthcare Access help you overcome language and cultural barriers in accessing healthcare services by providing many services. Our mission is to build a community free of health disparities and providing healthcare access to legal immigrants and other underserved population. At Ebenezer, we hold true to our 5 core values in everything we do: respect, empathy, integrity, accountability, and diversity are at the heart of who we are. In this video, we hope to provide some information to help you stay informed and healthy during this COVID-19 global pandemic. In this presentation, we will discuss COVID-19, presenting current statistics, as well as providing health information on signs and symptoms to keep in mind. Additionally, we will review what you should do if you think you or your loved one has COVID-19. And lastly, how to keep yourself and your loved ones as safe as possible during these uncertain times. Our aim with this presentation is to help you safely move about your day-to-day life while not putting yourself or those closest to you at harm. COVID-19 stands for coronavirus disease 19. As in 2019, the year was first discovered. It is a disease caused by a new type of coronavirus called SARS-CoV-2, which was first discovered in Wuhan, China. It shares many similarities to viruses that cause the common cold, with the most obvious being how it is built. COVID-19 is a coronavirus similar to many strains of virus that cause the common cold, in that when they were first viewed by scientists, they resembled the sun's rays that surround it. Since it was first discovered in late February 2020 in the US, COVID-19 has become controversial, with many rumors and false information being presented. Due to how new it is to humanity, our understanding of the virus is still changing shape almost daily as new information is discovered and our ability to manage improves. While the pandemic rages today, it is never too late for us to change how COVID-19 affects our country. Keeping in mind the facts presented here, in addition to CDC or WHO recommendations, we can slow the spread. Dr. Adhanom, the Director General of WHO, said, "This is the time for facts, not fear. This is the time for science, not rumors. This is the time for solidarity, not stigma. We are all in this together, and we can only stop it together." We cannot say this loudly enough, or clear enough, or often enough. All countries can still change the course of this pandemic. COVID-19, as with all viruses, can infect anyone. It does not care who you are or where you come from. It is simply does not care. As of January 4th, 2021, the US has the highest number of cases with nearly 21 million confirmed cases. In addition, it has taken more than 307,000 lives, also the most in the world, and continues to claim more every day. For most individuals, serious illness isn't common, but anyone can have mild to severe symptoms. As we currently know, people with other health issues are more likely to become significantly more ill. COVID is at least 3 times more easily spread than the flu. This has a number of factors. How many viral particles are coughed or sneezed out? And how long it takes for those with COVID-19 to see symptoms. Some people may have the virus, but just don't quite know it yet. If you or someone you know has symptoms, it is suggested to stay away from other people to prevent the spread to others. To the right are some simple things you can do to keep yourself or others healthy. Most effective seems to be wearing masks, washing hands, and keeping at least 6 feet between you and others. Cleaning your home and wearing gloves might also help. Symptoms usually start 4 to 5 days after a person is infected with the virus, but in some people, it can take up to 2 weeks for the symptoms to appear. Some people never show symptoms at all. When symptoms do happen, they can include fever, cough, trouble breathing, feeling tired, shaking or chills, muscle aches, headaches, sore throats, problems with sense of smell or taste. Some people have digestive problems like nausea or diarrhea. There have also been some reports of rashes or other skin symptoms. For example, some people with COVID-19 get reddish purple spots on their fingers or toes, but it is not clear why or how often this happens. COVID-19 may lead to serious problems: pneumonia, the lung infection, not getting enough oxygen, heart problems, even death. Risk of death is higher in older people, people with other health problems like heart, lung, diabetes, or kidney disease, people with low immune system like HIV or using certain medications, asthma, cystic fibrosis, or high blood pressure may be at higher risk for serious problems. Part of the difficulty in controlling the spread of the virus has been the spread from sick persons that have no or mild symptoms, so they don't truly know they have it. Again, practicing social distancing, staying 6 feet or 2 meters away from other people, and avoid close contact with anyone outside your household seem to be among the best prevention measures. Should you or family member have symptoms of COVID-19, like fever, cough, trouble breathing, please call your doctor or healthcare provider first. They will want to know about your symptoms before they see you. They might also ask about any recent travel and whether you have been around anyone who might be sick. These questions are meant to help them and are important to getting you the best help. Those with mild symptoms may be told to simply stay home or to avoid contact with people until they are better, typically 10 to 14 days. If your symptoms worsen, please wear a mask and let your healthcare team know that you have COVID-19 symptoms or are currently known to have the virus. This is helpful to your care team and it will help stop or slow the spread of the virus. As always, if you feel you need the help now because of trouble breathing or chest pain, call for an ambulance. Dial 911. Be sure to let people know what symptoms you're having. Should you or a family member have symptoms of COVID-19, please follow current or local guidelines. Stay home, away from others if you must leave. A mask wearing, hand washing are among the best things we can do to slow the spread. The local health department will likely ask you or loved one get a COVID-19 test. This will be a quick trip and may not even have to leave your car. Should you test positive, stay home and stay away from members of your family that do not have the virus. If you have breathing problems, a hospital trip may be needed. Remember to call ahead so that members of your care team can best treat you and protect themselves. Healthcare providers can use medications or drugs to help make COVID-19 less severe and to improve your breathing. While recovery can be as short as 10 to 14 days, some symptoms may stay around for months. Loss of taste or smell, shortness of breath, and so on. General COVID-19 prevention tips include through hand washing, 20 seconds with warm hot water, hand sanitizer with at least 6% alcohol may also be helpful, but should never replace a through hand washing. Try to avoid touching your face with unwashed hands, eyes, nose, or mouth, and cleaning things like cell phones when returning home may be helpful as well. Avoid other people. This means staying home when you don't have a good reason to go into public. Things like going for a walk or run outside is fine. You shouldn't need to feel like you have to stay at home. Social distancing by staying 6 feet or 2 meters away from others when you do not have to leave your home. Covering your nose and mouth with a tissue or coughing, sneezing to your elbow can help minimize spread. Lastly, cleaning things like tables or counters at least daily can help prevent the spread. If someone in your home tests positive, keep the sick person away from others and in a separate room if possible. Have them use another bathroom if able to. Also, eating meals in their own room and staying away from other members of your family and house pets until they are better would help keep you and other loved ones safe from the virus. If staying by yourself cannot be done, or common space, like sharing bathroom, has to be shared, both of you should wear a mask and wash your hands when in the same room or close contact. Clean often can help prevent the virus from spreading at home. Currently, there are 2 vaccines approved in the US under the emergency use authorization. Some may require 2 doses. Large clinical trials show that the vaccine is safe and effective in preventing the virus. Vaccines inform our body how to identify COVID-19 so it can defend us from it. For more information, you can ask your health care provider or visit NIH website at nih.gov. You can find more information about COVID-19 at the listed website created by the CDC, the Montgomery County Health Department, and the World Health Organization. Thank you for watching this presentation. It is truly our hope that you learned some about COVID-19 and keeping yourself and others safe. Should you have any more questions, please use our online form or call 937-580-8817. Thank you.